Early childhood development is a multidimensional concept, which means different things for different people. From Thrive's perspective, we want to look at it holistically, ages from conception to age 8. We focus on health, nutrition, early learning, responsive caregiving, and child safety and security as drivers in the child development process. In terms of outcomes, we look at things like health, nutrition, cognition, and socio-emotional development.
We know that early childhood interventions can be very effective and have persistent, large effects on a multitude of outcomes. What we don't know is how to adapt these models to be able to implement them at scale within the tough constraints of the poorer countries.
Scale-up by itself is a science. It must be planned. We must look at the factors that enable it and how do we give it the best possible chance of success. We have to influence policy, and policy thrives on evidence. And I believe that's the gap that Thrive will be able to fill. Where there is anecdotal evidence, it's an opportunity to test it and be able to provide policymakers with the information that allows them to confidently make policy choices, and in particular invest the limited resources that the country has, because they know that this is backed by science, this is backed by evidence.
To find out more or support this project, get in touch.
Hello, everyone. I'm Marlise Morsink, Deputy Program Director for Thrive at Oxford Policy Management. Welcome, and thank you for joining us for this 6th webinar in the Thrive in Conversation series. If you're new to the series, I hope the short film provided a helpful introduction to Thrive's research, which focuses on scaling early childhood development services in low and middle income countries. In our Thrive in Conversation webinars, we invite researchers, practitioners, and policymakers involved in early childhood development programs to discuss their experiences and share their insights. In today's conversation, we will focus on a model developed by the Lively Minds NGO to empower illiterate mothers in rural communities to play an active role in early childhood education, both in their own homes and in preschool classrooms. In Ghana, the Lively Minds model has been incorporated into a play-based preschool curriculum. The Ghana Education Service, which is the implementation agency of the Ministry of Education, started implementing this curriculum in northern Ghana over 10 years ago, and it has so far been rolled out to over 3,500 schools and communities, reaching over 250,000 children. Lively Minds is the first ECD intervention that we have featured in this webinar series, which has achieved this level of scaling through a government system. The focus of this webinar, however, will be on the findings of a large-scale efficacy trial that was conducted in 2017-18. This randomized control trial was carried out in 2 districts and evaluated the impact of the Lively Minds model on both mothers and on preschool-aged children. This period of child development is not as well researched as the first 1,000 days, although there is growing evidence that this next 1,000 days, these years from 2 to 5 years old, are just as important as the first 1,000. I'm delighted to be joined today by Sonia Kritikova, Deputy Research Director at the Institute for Fiscal Studies and Professor of Economics at Manchester University, who will be presenting the research findings, and Alison Naftalin, Founder and Chief Executive Officer of Lively Minds, the NGO that developed the model, and Adisa Tassa, Director for Early Childhood Education at the Ghana Education Service, which is implementing the model. The structure of today's webinar is that Alison and Sonia will give a 15-minute presentation on Lively Minds and the research findings. This will be followed by a conversation between Alison, Sonia, and Director Adisa, delving into a few specific topics. Then there will be time for audience questions, so please prepare to get involved. It'd be great if you'd introduce yourselves to each other and say where you're dialing in from via the chat tab. And then for questions that you'd like to address to the speakers, kindly put these in the Q&A tab. We will endeavor to get to as many questions as possible during the webinar, and we'll be sure to review questions, comments, and feedback afterwards. Finally, I'd like to let everyone know that we are recording this webinar, and the content will be made available afterwards on the events section of the Thrive Child Evidence website, where you can also find the recordings from previous webinars and associated materials. So with that, I'd now like to hand over to Alison Naftalin and Sonia Krutikova for their 15-minute presentation.
Well, thank you very much for the opportunity to present. My name is Alison. I'm the founder and CEO of Lively Minds. And I'll talk you quickly through the theory of change behind the model, and then Sonia will come in to talk about the findings from the randomised control trial. So very briefly, by way of context, as I'm sure many people in the webinar are aware, there are over 250 million children around the globe who are not receiving the care and education that they need in their early years. And this is harming their educational development, their health development, their language, physical development, and ultimately their life prospects. And we know that the majority of these children are in rural and underserved areas. And what we've seen over the past few years is that more and more governments across sub-Saharan Africa are investing in pre-primary systems. And we're seeing that more countries are seeking to expand their access. And while we think that pre-primary is really important and is a fundamental part of the solution to solve the early childhood development crisis, it isn't the silver bullet. And we know that it is expensive and slow to achieve universal pre-primary access. We know that largely pre-primary is focused on early learning rather than the holistic elements of child development. And we know that access doesn't guarantee quality. And areas that pre-primary systems find really difficult to support are, how do you get teachers in pre-primary classrooms really using play-based pedagogies, really engaging with children? How do you get teachers not just defaulting to rote learning? And Ghana's a really great example of this, because Ghana has had compulsory pre-primary since 2008. And it's the investment and the foresight that the government put in is really commendable. But nevertheless, the fact that 15 years after pre-primary has been established and with almost 100% coverage, the reality is that still the quality isn't there. And Sonia will show this in her studies, but in a baseline survey of kindergarten children, only 1 in 3 children in preschool could count 3 counters. So while pre-primary is important, as I say, isn't the silver bullet. Where we believe more focus is needed is in the home, because from our experience, both in Ghana and other countries, pre-primary tends to be from around 8:30 in the morning, maybe till 12:30, 1 o'clock in the afternoon. So a few 4 or 5 hours a day, which means that the vast majority of a child's time is actually spent in the home. And our view at Lively Minds is that the home has to be seen as important a learning environment as the classroom. And teachers aren't the child's only teacher. Parents are teachers too. But the reality is that particularly in rural settings, parents will typically say things like, I don't have the money, or I live in poverty, I don't have resources. How can I provide for my child? Or I never went to school, I can't read or write. How can I teach my child? Often even we find that parents living in very resource constrained circumstances will say, well, I live in poverty, nothing I can do is going to make that much of a difference. And the final frequent thing we hear a lot from parents is that they say, well, learning is the role of the school, that's the job of the teachers, I don't have a part to play. And so these 4 mindsets or narratives really frame how parents see their role in early childhood development. And our view at Lively Minds is that these are the things that we really need to work to change. So I'm going to briefly just talk to you about our solution. So our idea at Lively Minds is that parents are the sleeping giant of early childhood development. We believe that parents everywhere can drive their children's development and transform their children's future, regardless of their education or socioeconomic level. What needs to be done is to awaken that potential. So here's how our model works. First of all, teachers are trained to hold community meetings where they enroll mothers or parents in their community at a community meeting. They then provide 8 workshops for the mothers, each at around 2 hours. And these workshops are really designed to overcome the mindset barriers that I've just shown you and to teach parents simple games that they can make from their own resources that don't cost anything and that they can play with their children home as part of their daily routines. Once trained, the mothers take it in turns throughout the week to come into the classroom and run a play scheme where they teach different types of games for 1.5 hours as part of the school day. And they come in groups. So each mother only has to spend 1.5 hours a week teaching in the classroom. Once a month, the teachers provide parenting workshops that encourage and teach the mums simple things that they can do at home to improve their children's holistic development and play. And government, district, and regional staff are trained to monitor and support the teachers through their normal supervision visits and top-up training or continuous professional development work. So that's the model that we've been running in Ghana, and I'll hand over to Sonia to talk us through the results.
Excellent. Thank you very much. So I'm Sonia Kritikova, and I was part of the team that had the privilege of doing an evaluation of this program, and we continue to work with Lively Minds. I'm based at the Institute for Fiscal Studies. So the 3 questions that we designed the evaluation to kind of be able to answer are, first of all, whether it is indeed the case that such low intensity model training implemented within the preschool system with very marginalized and low educated mothers can result in improvements in knowledge and practice of mothers. Then our second question is, of course, can the program achieve improvements in child development? And a final question about what are the benefits of engaging parents specifically, rather than, for example, bringing in paraprofessionals such as teaching assistants into classrooms. So these are the 3 questions. And what we do to answer them, we ran a randomized control trial in 2017-2018 in Tolan and Bongo districts of northern Ghana, where we picked a random sample of 80 preschools and randomized them into receiving the Lively Minds program that year versus receiving it the following year. So the second group is our control group. From these schools, we took a sample of just over 2,000 preschool-aged children and their mothers, and conducted a baseline at the beginning of the school year and an end line a year later, so that we're able to evaluate effects of the program over the course of 1 year. Crucially, and please do look at the paper for details if you're interested, but our evaluation design allows us to look at not just the overall impacts on the kids attending the preschools where the program is running, but also on the mothers who are participating in the program, so the mothers who are coming in to run the play schemes and their kids. So then this allows us to answer that first question: do parenting knowledge and behavior change as the result of the program? Now, I want to just point out, and Alison has already made this point, but just the scale of the challenge here. So if we look at our sample in the baseline, so this sample of 2,000 plus kids and their mothers, only 18% of the mothers in the sample had any formal schooling. 94% of mothers reported being illiterate. and only 12% of mothers reported playing with their children in any way in the previous 3 days. So really super low levels of engagement with children and very low levels of education. Now, just before showing the results, I want to make the point all our impacts are reported in standard deviation units. A standard deviation is a measure of how much outcome scores vary in the population. And by expressing our impacts in terms of that, they can be compared to the differences typically observed in the population. The benefit of doing this is essentially that this allows comparisons across different outcomes, as well as across different studies. So with that in mind, moving on to the first set of results, you're going to see lots of these plots. They're going to be showing on the x-axis, you have the standard deviation units. You have the zero line of the effect. The impacts are shown with the dots. This is the size of the impact of the program. To the right of the line, these are positive impacts. To the left of the line, these are negative impacts. And if the confidence interval crosses the zero line, these are not statistically significant. So from that, you can see that we have a very large positive statistically significant impact on child development knowledge among the participating mothers, around the size 0.45 of a standard deviation, which is equivalent to moving from the 50th percentile of the knowledge distribution to the 66th percentile. So a large effect there on knowledge. But not just knowledge, we also see impacts on practice. So in particular, we see a very large increase in the proportion of mothers reporting conducting any play activities with the children in the last 3 days. So that increases 18 percentage points. If you remember, in the baseline, only 12% of mothers reported doing any play activities. And we don't see an impact on the amount of play materials available at home, very much in line with the message of Lively Minds that you do not need expensive extra things in the household in order to have a stimulating, productive time with your child. Finally, we see some evidence to suggest that it's not only the amount of time that mothers are spending with their children that increases, it's also the quality of that time. We see a noisy, so not quite statistically significant, but a positive impact on observed behaviors of mother and child when they're interacting in a game. So this positive behavior increase of about 0.2 of a standard deviation. So overall, see clear impacts on knowledge, on practice, on quality of practice. And these findings are really quite exciting in terms of what's out there in the literature. We have a lot of evidence on the potential for parenting interventions to improve child development in the first 1,000 days. Then we move over to preschool years, and there's much less on that, focus on whether preschool is good or not, and really not clear right now whether it is feasible to implement low-intensity effective parenting programs for supporting these older children when we are starting to think about school readiness kids. So very exciting results here on the potential for tapping into this underutilized parent power to support older children. Moving on then to our second key question, does this improve children's outcomes? And so here we're looking at first impact on an overall cognition score. We see a very statistically significant impact of about 0.11 of a standard deviation, which compares very well to effects reported in the literature on impacts of interventions in preschools. Now, this positive impact is driven primarily by improvements in executive function and in emergent numeracy, a bit less so by improvements in emergent literacy. Moving on to children's socio-emotional development. So here we have different measures. We don't see any impacts on emotional awareness. Where we see action is a reduction in behavioral difficulties. So overall in the sample, there's a marginally significant reduction of about 0.1 of a standard deviation, where with a stronger impact in reducing externalizing behaviors, so hyperactive disruptive problems, rather than internalizing behaviors. Interestingly, this result is really strongly being driven by boys. So I've just shown this breakdown by gender to show that there's a very large effect in reducing behavioral difficulties among boys of around 0.2 of a standard deviation. And we don't see impacts on girls. So really being driven by boys, this impact. So again, so we've talked to clearly this contributes more to the evidence on the potential of parents. This also speaks to, again, a small literature on how do we improve quality of preschools. Alison has talked about the immense achievement of Ghana in achieving almost universal enrollment. Now that kids are in schools, what do we do to improve quality? And here there's really very little evidence of programs that are implemented within government systems, not in parallel to. And most of that strong evidence is focusing on the potential for bringing teaching assistants into classrooms. We've done some of that work, but here we're really kind of thinking about something new and fresh, and that is, well, what about parents? Could parents be a viable tool as well? So final question then, why involve parents? There's obviously a cost element, so it may be that, but in addition to that, is there some added benefit to having parents involved in light of what Alison was saying about how much time children are spending at home and that teachers are not the only educators of children? And so what we do to look at this is we split up our findings by looking at impacts of the program on children whose mothers do participate in the program, so they are the mothers running the play schemes, and children whose mothers do not participate in the program. These are all kids in the same preschools. The difference is whether their mother is participating in the program or not. For cognition, we see an interesting lack of difference in impacts. So the impacts for the two groups are very similar. Where we do see a divergence is on the impacts on socio-emotional skills. So here we see that reduction we saw in behavioral difficulties is really being driven primarily by children of mothers who participate in the program, less so children of mothers who are not participating. So this suggests to us something about play schemes being the key ingredient for the improvements in cognition, but these changes in parenting practices playing an important role in reducing behavioral difficulties and improving socio-emotional skills. So to conclude then, overall, key things that emerge from this, there is substantial improvements in parenting knowledge and behavior. These can be achieved even among these low education disadvantaged mothers with low intensity training. We see improvements overall in children's school readiness. These benefits extend beyond the participating families, and the program can be delivered through the existing government infrastructure. And finally, headline, engaging parents might be a very powerful alternative to, for example, classroom paraprofessionals, teaching assistants, not just because of cost considerations, but also because of the significant added benefit of improving home environments, which we see in particular in the socio-emotional domain. Thank you.
Thanks, Sonia. And I'll just quickly jump back in just to provide a little bit of context of what we as an organisation have done since receiving the results from this trial. So based on the results of the study that Sonia's just presented, we engaged with the Ministry of Education, and we were invited to support the government through the Ghana Education Service to help them to scale the model across the northern half of the country. And so currently the program is being delivered and paid for by Ghana Education Service in just under 3,500 preschools and communities. Over 13,000 teachers have been trained to deliver the program. There are over 112,000 mothers who have enrolled and are running play schemes each week. And this year alone, there's over 290,000 children benefiting from the program. I think Sonia has given sort of a sense of the results and the mechanics of what is shaping impacts, but we just wanted to sort of give our views on what we think makes our content and our model successful. And I think we've come up with 6, which are, firstly, what we are trying to do through the program is to share ideas and information with parents that enables them to make choices on how they can support their own children at home. We're not asking them to do complex or time-consuming tasks. A lot of what we do is teaching them simple things that they could just do 10 minutes a day. So we do a lot of activities that can be easily incorporated into daily lives, daily routines that don't cost money, that don't take up a huge amount of time. The mothers are coming in to teach once a week in school, but they choose a time of day. So in Ghana, they choose to come in first thing in the morning, and then they can go off to their farms and lives. And it's just for once a week during term time. The context is really based on context and culture, understanding what materials, what resources mothers have available at their disposal. It's designed for parents who generally are illiterate, and many actually may really fear the classroom environment. If they haven't had a good experience when they were young in the classroom, they can be really fearful of being in the school or in a classroom environment. So a lot of the content is really about giving them confidence around that. Quite a lot of work is spent on building family and community support. So normalizing it, talking to dads about their role as well. And also, although the program, we're asking mothers to provide some time to come to the school, the focus of the program very much is around intrinsic motivation. So how this is beneficial for the parents, how this is beneficial for their own children, but also we we think it's really important that the mothers, they are committing to be on a serious government run program. And so quite a lot of our content's around accountability. So mothers are asked to enroll on an official course. They are expected to attend. There are attendance requirements. There is certification. There are rules on participation. Registers are taken, this type of thing. And we found this is really important in really sort of setting out proper terms of engagement. And finally, what are we doing with the model? So we have now supported the government of Ghana to scale the model across the northern half of the country, and Director Adiza, I'm sure, will tell you about the plans to now take it nationwide. But for Lively Minds, we're now working with currently with the governments also of Ethiopia, Gambia, and we're helping them to adapt the model for their own contexts. And what we're doing as an organization is we are providing technical assistance to new governments to support them to find ways that they can integrate the idea of parent-powered ECD into their own ECD systems and plans, and ideally finding governments that are just starting out on the journey of establishing their pre-primary systems so that they can build parents and parent-powered ECD into their systems from the very beginning. So that's it from the presentation. Sorry if we overran, but Marlies, back to you.
Thank you, Alison and Sonia, for some very interesting insights into the program and the impacts that it's already having. So I think that this question of just how innovative the program is really interesting. And I'd actually like to, I think, turn to Director Adiza with a question about what the perception is from Ghana Education Service, and does this still feel like a very innovative program, or has it been around for long enough in Ghana that it's very much accepted? So is it sort of still seen as unusual or radical? I know that, perhaps you yourself haven't been directly engaged with the Lively Minds program for that long, maybe only about a year, but are you already seeing shifts in how accepted the model is and how embedded it is becoming? Have we lost Director Adiza? No, there we are. Hello. I think you're still on mute, if you don't mind.
Yeah, sorry that I was muted. So thank you very much.
No worries.
Yes, and then good afternoon to everyone. I'm very happy to be part of this webinar, and especially when it comes to Lively Minds. Even though I have not encountered it for a long time, I am more than someone who even started it because of the unique nature of the model. Yes, when you look at the model, initially it was very innovative, radical, transformative, and in fact, where we have not yet experienced it, is still innovative. People are still wondering, how can illiterate mothers go into the classroom and deliver lessons? But where Lively Minds has been operating, it is now a normal norm. We have integrated it into our school system. So it's no longer an intervention that is one time or someone comes to tell someone do this. No, it is now part of the school system in the 8 regions that the model has been introduced or implemented. And we are seeing mindset shift. School authorities are now embracing mothers as supporters to deliver the instructions with them. And then also the community members are also appreciating the mothers for their voluntary work. And then the mothers themselves are also happy that they are building a lot of confidence. They are getting a lot of good relationship between their children at home and both at school. So in fact, it's a game changer. That's what I have to say for now. Thank you.
Thank you so much for those reflections, just from the perspective of the implementing agency. I'm curious about who is actually the most difficult party to encourage or to convince to adopt the model. And going back to you, Alison, it really is this question of, was it hardest to convince the government interlocutors to take on a play-based model? Was that, because that, I think you've already mentioned, was a departure, that when Lively Minds was being introduced in the first instance, rote learning was very much more the norm and de rigueur in the classroom. So it might have already been that play-based learning is an innovation and something that people weren't that comfortable with. And then on top of it, there's the notion of, oh, we'd like these mothers who themselves are not very educated to be delivering it. So from your experience in Ghana, which was the most, who was the most difficult to convince?
I think, and interested to hear also Director Adiz's view on this. I think probably before we got the RCT results, we used to go to, I guess, government, but also to multilaterals or sector experts, funders, and tell them about the model. And honestly, they would laugh us out of town, and they would just sort of say, "You don't understand. Mothers won't do it. They don't have the time. They don't have the willingness. They can't do it." And everyone just assumed that parents wouldn't be interested. They wouldn't make the time. They wouldn't prioritize their children. And so it did take a lot of work and effort to sort of get the agreement to do the pilot and then to do the scale up. I think that in our experience, once implementation begins, I think there's some natural hesitancy that we see from district officials or regional officials. They sort of think, well, how will this work? Will mothers really enroll? But actually, once they get started and the program is very structured, and they see it happens, sort of seeing is believing. So I think generally that the hardest thing is there's just generally a perception that mothers won't want to do it or they won't be able to do it. And as soon as people see them doing it, they realize that it can work. And Adiza and I, a few months ago, we hosted a visit for some other countries. So we had officials from Senegal and Togo and Rwanda, and they were exactly the same. They were just thinking, how is this going to work? But as soon as they see it in action, they immediately see that it is possible. So yeah, I think it's showing what really can be done is always the hardest thing.
Thank you. I think that very much echoes Director Adiza saying, once you see it, you get really great uptake and buy-in. It's only when people haven't actually seen it in action yet that there's a skepticism. Which leads me to a second topic that I'd like to raise. So once we've sort of established that, yes, mothers are able to take on this role of teacher in the classroom as well as at home for this age range of student, then there is possibly a somewhat contentious issue of should they be paid? So if they're being involved within the school system, at the moment they're being involved as volunteers, as unpaid workers. One could say perhaps that, well, they're getting a lot of benefit because they get a lot of training, there's capacity building, and all of that is free of charge. So you could argue that there's maybe something of a balance, but it is somewhat, or it can be viewed as a somewhat thorny issue. So I'd like to hear each of your takes on that. I'll put 3 questions out there and just choose which one you might like to answer. So first of all, if play-based learning is in fact an essential element of the ECE curriculum, is it feasible long-term to rely on volunteers to provide this? That's one question. Another question is, could you speak to the experience that you've had talking to mothers who do volunteer and feedback on what they themselves are saying about, do they see themselves as getting more benefit or giving more benefit? And then the third question is, from a women's empowerment perspective, does not paying women for their work outside the home perpetuate discriminatory gender pay practices? So you can choose one of those 3 or a combination thereof. But Sonia, perhaps I could go to you first, just for some pros and cons, maybe from an economist's viewpoint on this matter.
Yes. So maybe 2 points. I mean, I think the overall concern about the ECD workforce being consisting of often overburdened, often vulnerable women is an important one, and maybe an under-researched one. I think in this case, though, I think the first point I would make from an economics perspective is this is a choice that the women are making. So they're being offered something, and the ones who find it to be desirable to participate in this are the ones who take it up and do it. So in some sense, their behavior is a sort of revealed preference, and not everybody participates and not everybody needs to participate. Only those for whom essentially the cost benefit works out. And so I think that's a strong argument to sort of say, well, this is their choice, they're making that choice. And in some sense speaks to Alison's point about the skepticism saying, well, no one's going to come and do it. Well, obviously for some women, this is an optimal decision and they're making it. I think that would be the first point. I would also make a point about if we see this from a parenting intervention perspective. So Lively Minds have worked in other countries using other infrastructure. Parenting interventions are intensive. They require parents to invest a lot of time in playing with their children. This is a parenting intervention being implemented through existing infrastructures. And so it's not clear to me that the burden is that different. It's just that the benefits are being spread out to a larger group of children, and the infrastructure that's being used is public service delivery infrastructure. So that would be the 2 points I think I'd make. Can I just say that we have looked, and I didn't present those results, but we have looked in the trial. We see absolutely no evidence of adverse impacts on women's well-being in the measures that we have in the trial. We also see some weak, because of statistical power, but some indication of maybe positive spillovers on the younger siblings in the household. So just in terms of thinking about these wider costs and benefits, that's a positive picture.
Really, really interesting perspective. Thank you. Thank you, Sonia, for making those points. Director Adiza, I think you are calling in actually, that you're in the field at the moment in Wale, and you are probably there with some others at the moment who are participating in one way or another. Could you give us some thoughts from the fields and from the implementation?
Yes.
Context?
But then I want the participants to understand that when we call mothers, it doesn't mean that biological mothers are found in the classrooms. because they are women. That's why we are calling them mothers. So those participating are not biological parents of the children in the classroom. They are volunteer mothers that are rallied around from the community to support the upbringing of the children. So that is just by the way. Yes, I'm on the field, and today I had an encounter with them, and then this motivation issue cropped up. And like Sonia said, in fact, it is a two-way sword, because one, the mothers are benefiting, and then two, they are also giving out. So should we say that because they are benefiting, so they don't need any form of motivation? No. They are really giving something to society. And especially so because it's not every woman in that community that is hooked onto the program. So if they are not motivated, others will do a lot of harm. But when they get some form of motivation, then those behind will also be encouraged to enroll, so that it wouldn't be just a few of them hooking onto the program. So yes, motivation is very important if we want to sustain it. But we are looking at what kind of motivation should we give to these women so that it will be sustainable? Because we cannot bring salary that we are going to salary them. No. So if we give them tangible things, it's going to create a lot of friction, and we are not careful, the program will crash. So what we intend doing is we are exploring ways of providing them with skills that they can use to gain some kind of employment or to make some livelihood. So after spending 1.5 hours in our schools or in both the parent and us schools, helping our own children, then we'll provide you with a skill that will help you gain economic independence. So we are trying to talk to the assemblies, the municipal and district assemblies, to find ways of getting these women some kind of skills, so that they can also be proud that after benefiting intrinsically, there is something that they can also point to tangibly, that this is what I have benefited after joining this program. And we are also telling the school authorities, the district directors, and then the secretary supervisors, that they can organize their best and recognize these women in public. Just recognition. Organize their best, organize programs, and then let them know that, let the community know that these are our gallant women who are helping drive home our education to make our children school ready. Thank you.
Thank you very much for that. And it's a real reflection on what constitutes compensation, as it were, and what people are getting out of something that they're putting their energy into. I think those are really interesting points. I'm afraid we're going to have to bring the conversation to a close there, because we're running a bit short on time, and we do want to get in questions from the audience. And I am looking here through them, and there are a number on father involvement and or fathers and other carers. This did come up just now in Director Deese's comments about its mothers are not necessarily biological mothers of the children. So I'll just ask the questions. They are, first, why did the program only focus on mothers in the study? Was there a concerted effort to recruit fathers as well? In contexts where children are living with grandmothers, extended family, and so on, are other extended family members recruited actively? And does that change buy-in to the program? So I think Director Adisa touched on some of those, but maybe Alison, if you'd like to supplement.
Yeah, so we did a lot of experimentation around who should participate in the program, and we did quite a lot of testing with mums and dads together, and we found that when you had mums and dads together, it had a suppressing impact on the mothers. So if you get a large group of women together and it's all women, it was really easy for them to be confident and to speak up. As soon as then, in these quite hierarchical communities, as soon as then there were men involved, the men sort of took all the group leadership roles, the men wanted to speak first, it stopped the women's empowerment elements. So what we decided was it's better to have this as a mother's own program, because it was much better for the well-being, for the confidence of the mums. But we also, as part of the program, dads are engaged, and there are some parenting workshops just for dads, and there are some that bring them together. So there is quite a lot of work on the role of dad as caregiver, but it was much better for implementation to have this as a women's group only. And we found that in both Ghana and Uganda, very, very similar. So yeah, that's why.
Can I just add on to that? Because there's a question that we've had about equity and inclusion. And so it is about, so who are you recruiting? How is the model catering for children whose parents have disabilities of any kind?
Yeah, I can answer that. So and I mentioned we have a community meeting. There's a lot of work on access and inclusivity in really making sure that everyone in the community is invited to participate. So there's specific guidance on make sure that, if it's a community with different religions or different tribes or ethnicities within the group, and also parents with disabilities who may sometimes not be as included. Also, there's a lot of work on bringing children with disabilities into the play scheme and how to adapt. So we do actually have quite a lot of parents themselves who have disability who work on the program and really encouraged to participate, teachers and children. So it is very much part of the curriculum, and there are also a lot of the parenting workshops really designed to look at that inclusivity. And the other thing I just say is part of the inclusivity is obviously literacy levels and making sure people who have been to school, haven't been to school, can join in. So the the trainings are conducted in the local language. So Ghana has many different languages. And so that's why, again, using the government systems means that the teachers who are local language speakers deliver in the local language, and all the training for the students is done in the mother tongue with no literacy requirements.
Wow, thank you. That's certainly learning in your own language is really key. The next question I think I'd like to address to Director Adisa, please. And the question is about the curriculum and how it's been designed to supplement or complement the mandatory curriculum in schools. So assuming there is a mandatory curriculum, how is this fit around that?
Thank you very much. As I said, now, as I speak, we no longer have Lively Minds. We have designed a program, we have patterned it to suit the curriculum of Ghana Education Service. So there is no disturbance in terms of the curriculum. Because before the intervention was introduced, the curriculum was studied to see if it was going to fit into it before it was accepted. So the preliminaries was done long time before its implementation. So all those bottlenecks have been resolved. And now when you go to where this program is running or implemented, you see that the daily plan has play scheme as the first activity. It is now incorporated into the national curriculum. So NACA has evaluated it and then has given us a timetable that has that aspect for all the areas that are implementing the program to follow. So I don't see any problem with it.
That is really impressive. Thank you so much for that insight. I think in our pre-chat for this webinar, we were also saying we need to have a follow-on webinar to talk more specifically and in more depth about the implementation and the scaling of this, because there's some fascinating stories and experiences to share on that. So the fact that this is now the Ghana curriculum, it's not anything other than that, is
It's no
really
longer
fascinating.
Lively Minds. It's now
Exactly. Thank you so
Ghanaian
much.
curriculum. So now the Ghana
Fantastic.
government has fully taken over. So the Lively Minds is now behind and then guiding. They are no longer in front. They are now behind and then guiding. Then the Ghana government is taking the front row. So the monitoring, every activity that needs to be done is done by the Ghana government now, but we still have Lively Minds at our back. They are invisible now, but they are with us.
Yes. That is, yes,
Yeah.
it's a
And
phenomenal.
then very soon, yes, we have started scaling. There are two programs, two major ones. We have the teacher capacity building, which is the KG Insight. We have started training the DTSTs, and we'll be finishing by 4th July. Then hopefully next year, the play scheme will also be rolled out nationwide. It will no longer be limited to the 8 regions, but nationwide, but in rural communities, where we have good stuff for peri-urban and urban mothers too. So just to whet your appetite. Thank you.
Thank you. Thank you very much. Which leads me to another, thank you, Director Adisa, for another question from the audience. The question is about community engagement. And Alison, if I could direct this to you. To what degree was the secret sauce that you described in your presentation, to what degree was that co-designed with community, and how much local input and local perspectives were taken into account?
It was completely designed and co-designed. So I'm the founder of Lively Minds, and we did not have glamorous beginnings. So basically, for the first 6 or 7 years, it was a few of us sort of on the backs of bikes or bicycles going into communities in Ghana and Uganda, very rural communities, and designing the program from scratch, figuring, understanding community dynamics in the two different contexts and countries, figuring out kind of the resources available, the mindset barriers, how to get the content really relatable in the two different countries and contexts, how to sort of drive up sustainability, this question of incentivization, sort of understanding what enablers and barriers. We did a huge amount of work even before we did the study, which was sort of 2016, 17, before that, to really, really make sure that it was right, context right at community level. And then we turned our attention to sort of really getting it integrated into government systems. But the content side of it was entirely co-developed with communities, not just in Ghana, but as I say, in Uganda as well. And I think that sort of the different contexts has really helped our confidence in understanding how to make adaptations for context and for cultures, and also ultimately now in being able to replicate it to new countries as well.
Well, thank you so much. Thank you, Alison. And at this point, I'm afraid I'm going to have to wrap up. Thank you so much, Director Adisa, Thank you so much, Sonia, and thank you to our audience for these very key questions.